All right, so Dr. Katie, Tranquil Mind naturopath in Guelph. She's an expert in natural treatments for mental health concerns. And today she's going to talk to us about the most common and commonly missed mental health concern in children, which is anxiety. So come on up.
When I was a little girl, I used to get stomach aches. The pain would be so bad that sometimes I would cry and have to go home from school. My parents were worried, my teachers were worried, and so they took me to see my family doctor. And my doctor, when he couldn't figure out what was wrong with me, he ordered some tests. I still remember the chalky, thick drink and laying there on this cold, hard table, trying my best not to move, while an X-ray took pictures of my digestive system. 20 years later, I'm sitting in my office and sitting across from me is a 9-year-old girl. And she's there because she gets headaches. And they're starting to happen every day at school, and her mom's getting really worried. And when I ask her about them, she tells me that they don't really bother her any other time except lunch. And this is right before recess, and when I ask her about what happens at recess, I learned that she's bullied. And this child and I are actually suffering from the same condition. It's common. It affects 1 in 6 children. And it's commonly missed, meaning it's often missed by your child's doctor. The condition is pediatric anxiety. And by the end of my talk tonight, you're going to know what the hidden presentations of pediatric anxiety are and what causes anxiety and what we can do about it. And so that's my anxiety moment here. But so you're going to know so what does anxiety look like in children? Well, some cases of anxiety are really obvious. When a child, their worries and anxieties get in the way of their day-to-day life, that's an anxiety disorder. When they are trying to catch the bus in the morning and you have to tell them, the bus is safe. It's okay to get on the bus. And don't worry, I'll be here to pick you up when you get back from the bus. And don't worry, the bus is very unlikely to catch on fire. When you have to go through that for 10 or 15 minutes every morning to get your kid on the bus, that's an anxiety disorder. But as in the examples in the beginning of my talk, anxiety can also be a little more insidious. And so some of the common presentations of anxiety in children is actually headaches and stomach aches. And when pain is caused by anxiety, it has a few unique characteristics that make it easier to identify. There's 3 of them. The first is that the pain is generally not specific or localized. When you ask a child with anxiety to describe their pain or tell you where it is, they kind of just point to their whole head or just the middle of their stomach. And if you give them a list of words saying, or ask them what it feels like, they just kind of shrug and say, it just hurts. And then the second characteristic is that there's often not other symptoms in the same body system as the pain. So I'm suspicious of anxiety when a child's stomach pain has no constipation, no diarrhea, no nausea, just pain. And same with headaches that don't have any eye strain or vision problems, no neck tension, no sensitivity to light or sound. This isn't to say that someone can't have irritable bowel syndrome and anxiety, or migraine headaches and anxiety, because of course they can, but it's just something that I consider. And the third thing that I look at when pain is caused by anxiety is that often it happens at a specific time or place. And so it's important to consider anxiety when a child's getting migraine headaches just on Sunday nights, or they get stomach aches at gym, or just when practicing piano. It's important to realize that these children are not faking it. The pain is real, and they deserve to be treated. And it's very important that we treat childhood anxiety, because contrary to popular belief, anxiety is not something that simply kids grow out of. And when anxiety is left untreated, these children end up back in my office as adults, and not just with anxiety. Childhood anxiety puts kids at increased risk of a variety of other psychiatric concerns, including obsessive compulsive disorder, unipolar and bipolar depression, substance abuse, and eating disorders. So this really isn't something we want to miss. The second hitting presentation of kids' anxiety is actually sleep disruption. So if your child has trouble sleeping, it may be due to anxiety. There is a lot of anxiety, and a lot of people who have anxiety have a lot of trouble sleeping because they feel like they can't turn off their brains. And this is really amplified in children whose imaginations can create interesting and scary pictures that really stop them from being able to sleep. And so anxiety is something to consider in children with difficulty sleeping, particularly when they have difficulty falling asleep. And so, now that we're able to identify anxiety, this is the beginning, not the end of the story. And so, how do we treat this? Well, in conventional medicine, the first thing that's usually offered is called cognitive behavioral therapy, or CBT for short. And this is a structured way of thinking about your thoughts, feelings, and actions. And it's also a way of giving children tools so that they can rethink their thoughts and choose different actions. And this is a very effective form of therapy for anxiety in children, and it helps 1 in 2 kids with anxiety. And the other thing, if you go to your family doctor, that they'll often offer either as a first step alongside treatment, or if therapy isn't working, is medication. And there's a lot of different medications out there that get prescribed, but the best evidence is for a type of antidepressant called a serotonin reuptake inhibitor, or an SRI. And the combination of an SRI and CBT helps 80% of children. So why am I here? As a naturopathic doctor in Ontario, I cannot prescribe pharmaceuticals like serotonin reuptake inhibitors. And although I have some training in cognitive behavioral therapy, when someone in my practice needs this, I usually refer out to a clinical psychologist or registered social worker. So why am I here? What I do is I work with families to answer parents' most burning question. This is a question that I find often goes unasked by many family doctors, child psychiatrists, and pediatricians who simply don't have the time, training, or resources to fully consider this. What's the question? Why is this happening? What is the cause of this child's anxiety? Why this presentation of anxiety in this child? In my practice, this is my focus: identifying and treating the root cause of anxiety. And there are many root causes of anxiety that range from genetic to environmental, causes from nutrition, causes from a child's life experience. And these causes, when identified and then treated, knowing what that cause is, the results can really be quite profound. Think about this. Magnesium is one of the most common minerals in your body. And without enough magnesium in your diet, you start to experience deficiency symptoms. So restless legs, difficulty sleeping, and you've probably guessed, anxiety. And just like scurvy from not enough vitamin C, or just like rickets from not enough sunlight, not enough magnesium is a reversible root cause of anxiety. No drugs, no therapy. You reverse the deficiency and teach the patient how to eat so that they don't have a deficiency of magnesium in their diet, and they no longer have anxiety symptoms. The results are just as profound when the cause of a patient's anxiety is reactive hypoglycemia. This is actually quite common in people with anxiety who have a higher proportion than the rest of the general public of being intolerant to sugar. And when they consume sugar, their body actually produces too much insulin. And so what happens when your body produces too much insulin is your blood sugar actually goes way too low. And when it goes low, these patients experience symptoms. So they get shaky and they get heart palpitations, and that makes them feel like they have anxiety. On a low glycemic index diet, the patient's insulin stabilizes and they no longer experience anxiety symptoms. Even when the cause of anxiety is something that's less easily reversed, so I'm talking about genetic or trauma causes, even when it's less easily reversed, identifying that that is what is going on for this patient is invaluable. It allows for targeted treatment towards that cause. And in addition to that, it changes the patient's relationship with their symptoms. In my naturopathic practice, this is my focus. Identifying the cause of a patient's anxiety and working with them, providing natural treatments that not only work in the moment, but that work over time to treat the cause or causes of their anxiety. It is my mission not just to remove the symptoms of anxiety, but to uproot anxiety from my patients' lives and help them create calm. Thank you.